outpatient knee replacement, which really is a resurfacing procedure, is essentially the same as other knee replacements that I do for patients not as an outpatient. What's changed really that allows it to be done as an outpatient is the technique of getting it in. So using minimally invasive, muscle sparing, no tourniquet, avoiding the vessels so that there's very little bleeding associated. Long-acting medications, specific kinds of blocks in anesthesia.
Right.
This whole combination of things in medications and technique is what allows that same surgery to be done in a way that allows people to go home and walk on it right away. But the expectation is still that it will last every bit as long as any other knee replacement.
Right.
Typically the surgery is about an hour, hour and a half.
That's
something
all.
like that. The navigation adds a little bit of additional time, the data collection and then the computing time and stuff, but still most people are in and out of my time in the operating room is about an hour and a half. And there's production time on both ends, and then people, as I said, will stay for a couple of hours afterwards. When we do that kind of block of the nerves, then we don't have to do as deep of an anesthetic. Right? So you'll be unaware of what's going on,
just
but not
mild,
but
to where
we
you
don't
can
have
come
to use
out
a
of it
deep
quicker.
anesthetic. Right, we don't have to use a deep anesthetic to prevent the pain and the feeling. Now there's other things that go along with it too. So one of
and that in turn, I should say, is safer for the patient.
It is. That's
not
right.
Using the deeper
It is
anesthetic.
safer.
Okay.
So I do the surgery without using a tourniquet. So it used to be that you would march through the tissues, cut through the muscle and everything else, and then identify the bleeding when you were coming back out again and try and coagulate them as they go. Instead, I sneak around the vessels. So no major vessels are cut in the surgery the way that I do it. I also don't cut through any of the muscles or the ligaments. It's a sneaky way to get in, and that allows those tissues to stay still functional and usable and comfortable right after the surgery. So the problem with doing outpatient knee replacement in Tennessee for a long time was that there really wasn't any place that was set up to do it.
Right.
So we've recreated basically hospital size, level, even better operating rooms in an outpatient surgery setting that's got patient rooms, and it's set up specifically so that we can do this and let people go home. We use a virtual reality workstation, 3D cameras in the operating room, it's digital operating rooms, and I basically do the knee replacement on a VR workstation and then translate that to the patient based on specific data points that are taken from your knee.